So I'm with Julie Jomeen. As the Dean of the Faculty of Health Sciences, what is your role within the Hull University?
Okay, so my role as Dean of the Faculty of Health Sciences is really to provide oversight of the three schools. Two of those schools, the School of Health and Social Work and the Hull York Medical School, are schools that develop students to be healthcare practitioners and clinicians of the future. The other School of Life Sciences includes psychologists, sports health and exercise science and biomed, which are also professions affiliated to health, but are not health practitioners as such. So a key role for me really is to ensure we deliver high calibre graduates to fill the healthcare workforce of the future, locally, but also regionally, nationally and potentially internationally.
Awesome. What attracted you to nursing in the first place?
That's an interesting question really. I think that I was interested in being a nurse from being about 13. I liked the appeal. I suppose I wanted a career where I was able to provide care for people that I felt was satisfying in some regard, that could potentially give me a career, although perhaps at 13 I wasn't thinking any further than being a clinical nurse. But as I got older, I recognised that the opportunities within nursing and midwifery and allied health professionals are boundless in many ways really. There's lots and lots of different pathways that you can take to develop your career, whether you want to stay clinical, whether you want to move into education, whether you want to move into research, whether you want to move into leadership and management. There are so many different options around nursing that it really just appears to be both a valuable, exciting career that provides lots and lots of different opportunities.
Awesome. What was your experience of working as a nurse and midwife in the NHS? And feel free to give as many anecdotes as you like.
I remember it always being busy. I remember starting as a student nurse and it being quite scary.
Yeah, I can imagine.
An environment where you've never been before, with people speaking a language that seems completely alien at the time. Lots of jargon, lots of ways of describing things that nobody else in the real world would ever talk about. Always busy, never really, but always fulfilling. Sometimes absolutely exhausting, both physically and mentally. At times really, really sad. I've dealt with some really difficult, over the years, really difficult situations. You're dealing with people and their real lives, and you're dealing with not just people but their families and that whole kind of context of illness and disease. But the flip side of that is lots and lots of really, happy times. I suppose having spent the majority of my career as a midwife rather than a nurse probably, obviously the majority of that is much more towards the happy end of the spectrum than the sad end of the spectrum, and I think I'd describe nursing and midwifery as a privilege, actually. A privilege to be part of people's lives, often at a really vulnerable, testing, sometimes really difficult time for them. And you get to play a part in that to hopefully make it the best experience it can be for that individual, no matter how good or bad that situation is. As a nurse and a midwife, you can always add something. And I suppose the other thing I've probably not touched on, we hear a lot of negative about the NHS. We hear about it being a really difficult place to work, a really hard place to work. And healthcare will always be a difficult job in lots of ways. But I've had lots of fun over the years as well. There's a certain sense of humour that sits amongst nurses, midwives, doctors, allied health professionals, that we use to get through the day, I think. And over the years I've made lots of good friends, people who are friends for life, and I've had some really good fun as well.
Awesome. How did the NHS equip you for a career in higher education?
Well, I suppose, how have I ended up here, I suppose, would be the question, really. So how I've ended up here is as a nurse and a midwife who was, I suppose, educated herself in the value of evidence-based practice. So why is research important for practice? Why do we need research? And I suppose early on it was an appreciation of the fact that we need research-based evidence to give the best possible care that we can give and the most contemporary care that we can give, the most up-to-date care, as well as making it the best experience we can for our patients and the people we look after. And I suppose as I went through my career, that led me to begin to think about starting to do research myself. Was I interested in really kind of being part of that evidence generation rather than just the end user of evidence? And so I began to do a little bit of primary research, if you like, when I was a midwife. I did a very small study looking at women whose waters had gone prior to going into labour.
Okay.
That study got published. The most amazing feeling when you see that very first paper with your name on it out in print that you know other people are going to be looking at and using in their own practice. And I suppose I got the bug then. The work that we did, though it was a small study, got cited in national guidelines for evidence-based practice, and I suppose that just made me feel that research was a different way of making a difference. And, you know, I like to believe I'd always strive to give the best care I could possibly give to every person I'd looked after. But this was a way of making a difference at a broader level, at a different level. And so that led me to then, I suppose, pick up a more academic route, do more qualifications, do a master's in research, do a PhD, which has led me to kind of now move into an academic context. But I think my experience of doing research in the clinical environment initially really helps me to still keep connected. So all the research I do, even today, is still all about service development, patient care, and really strong relationships with collaborators and partners in the NHS. Or healthcare more broadly, because not everywhere's the NHS.
Yeah. How do you think doctors and nurses coming from abroad benefit from working in the NHS in that sort of environment?
I think we're an extremely well-established infrastructure, I suppose, for the provision of healthcare. It's a different model to what many nurses and doctors will see in other countries. Obviously, it's free at the point of access, and that's not something that other people will be familiar with when they come from other countries. And that means we're giving care to people right across that spectrum, from the most kind of deprived end of the community, right up to people who are obviously, you know, much wealthier and in a very different situation. I think that allows us to, or enables us to understand sort of a real breadth of not just physical healthcare provision, but kind of the psychological and the social aspects of healthcare. And I think that's an expectation of the role here in the UK, particularly you know, for nurses and midwives and allied health professionals, that element of caring that's above and beyond just giving physical care, but is about actually giving, you know, psychological, social, spiritual, you know, ecological care, if you like, is a really valuable part of what we do and what we train our nurses here and our midwives here to do. And I think the experience is vast. We have high levels of speciality in some really kind of key areas of healthcare. And I think I would like to think we train some of the best practitioners in the world, many of which choose to stay in the UK and work within the NHS. So I think there's an awful lot we can offer to people coming over to this country. The opportunity to have professional development that sits alongside your clinical experience is vast here in the UK as well. So there's the opportunity to really continue to develop both your own personal skills, but also the opportunity to develop your career whilst you're over here.
Awesome. Julie, Jomeen, thank you very much.